We've all experienced it. That moment when you look at someone's face and something just doesn't seem quite right, and you can tell that they've had work done, whether it be plastic surgery or they've gone overboard with filler. There's a psychological trigger in our brains when we see a face that looks inauthentic and doesn't match our expectations of natural beauty. Then suddenly we feel as though the face we're looking at is a fraud. So I'm going to tell you the top 5 mistakes that people make that cause them to look unnatural. And if you're thinking about getting filler or plastic surgery, you don't want to make these mistakes. So let's dive in. Mistake number 1, when you push past the boundaries or stray too far from your natural features. We see this a lot with specific facial features, and the lips are the biggest culprit to which people, mostly women, are pushing past their boundaries of their anatomy in order to achieve fuller lips. But it's really obvious when you over-inject lips because our lips are bound by distinct borders. And we've spoken about this in other videos, which is why you can usually tell when someone has overstepped their boundaries of their anatomy in their lips, not to mention when they speak, the tissue doesn't have a natural looking movement. It's more stiff. You have to understand that when it comes to the lips, you have to work with what you naturally have, and there's only so much volume you can inject before your lips end up looking unnatural. Another common area that people overstep the boundaries of their natural anatomy is their cheeks. People end up giving themselves fuller cheeks with more outward projection than they ever had, and you can usually observe this in the anterior or front region of their cheeks and the lateral or side area of their cheeks. Our cheeks naturally lose volume as we age, so there's no way your cheeks would be more outwardly projected than they were when you were younger. Now, it can get like that if you gain weight, but then if you gain weight, it would be reflected everywhere on the face, not just your cheeks. Nicole Kidman, Zac Efron, Lisa Rinna, they likely enhanced their cheeks with filler to give themselves a lot more fullness and projection than their cheeks ever had. And we spoke about this filler fatigue look in another video, and it sets off a red flag that they've gone beyond their natural anatomy. I actually couldn't help notice Nicole and Zac Efron's cheeks in the new movie A Family Affair. I was wondering if they were going to the same injector. Straying too far from your natural facial features especially applies to nose jobs. When it comes to the nose, you cannot change the characteristics of your nose too much. Otherwise, you could end up looking like a completely different person and you can lose your identity. And this is what happened to actress Jennifer Grey. Jennifer starred in the 1987 hit film Dirty Dancing, which catapulted her to fame. No one knew this indie film was going to be so successful, but after this movie, her mother and industry advisors told her she should get a nose job, so she underwent a rhinoplasty that drastically changed her appearance, and this negatively impacted her career because her distinctive look was part of her on-screen identity, so the nose job essentially ruined her career. A lot of other celebrities have likely had nose jobs that were not so noticeable where they maintained their identity. Jennifer Aniston, Ashton Kutcher, Halle Berry have all likely had nose jobs. The difference is they didn't stray too far from their natural facial features, so it's important you find an aesthetic provider who can customize your injectables or surgical procedures to your face and features. Mistake number 2 that can make you look unnatural is if you alter your facial features in a way that doesn't match or harmonize with your other features. It can lead to unnatural looking facial harmony. Your racial and ethnic background play a big role in determining your facial structure, especially the size and shape of your nose, lips, and the structure of your cheeks. And naturally unaltered noses and lips usually harmonize with each other. If you look at people who have naturally full, very large lips, like the celebrities on the top, they usually don't have very narrow noses with pointy nasal tips like the celebrities on the bottom. Now, they may have a small nose for their facial size. I'm not saying you can't have large, full lips and a small nose. Angelina Jolie and Kerry Washington are good examples. They both have naturally full lips and they have relatively small noses for their facial structure, but notice their nasal tips are not very pointy. And Angelina actually likely went on to have a nose job. As you can see, her nose has become more narrow. Nowadays, people are modifying their features to which their noses and their lips just don't make sense with what Mother Nature would create. Even Joe Rogan speaks of this unnatural harmony when it comes to Kim Kardashian's body.
Here's the thing. What they're doing is not aesthetically pleasing because it violates your sensibilities. Because you look at the ass and you look at the legs and you go, what's wrong here? How did you get that ass with those legs? They don't go together.
Something in there. I don't know what it is, but there's no way in nature you would have those skinny ass legs like that that are total unathletic legs. That's the legs of someone who doesn't work
out. That's like her sister. Yeah, exactly. Right. There's no muscle at all.
No, nothing. I mean, she maybe works out a little bit. Like, look at her scrawny arms. Like, she's not an athletic person.
Same thing with the face. These features don't go together. A very small, pointy, upturned, narrow nose, like someone from Northwestern European ancestry, doesn't go with very full, large lips like this, like someone from West African ancestry. And this mismatch or combination strongly suggests that they've enlarged their lips with filler, and it doesn't look natural as they have all the signs of overinjected lips that we spoke about in a previous video, which explains how to tell if your lips look unnatural. Comment below if you've seen this look. I feel like I've seen this look all over Instagram with some of the influencers who've gained a large following. Back in the day, in the 80s and 90s, you would see a lot of these unnatural looking nose jobs that sometimes produce this scooped, turned up pinch look. LaToya Jackson, for example, had a few nose jobs, and I don't know anyone who would naturally have a nose like this. What can sometimes happen is you can get this damaged appearance to your nasal cartilage, which can happen after nose surgeries, and most of the time it's from more than one surgery. You can get this pinched nose deformity or nasal collapse, which occurs when too much cartilage has been removed or the structural integrity of the nose has been compromised. Little Kim, same thing. She likely had multiple nose jobs and her facial features look mismatched. In the past, rhinoplasties often produced this done look, but this has become less common as surgical techniques have advanced. Nowadays, most people do not want the scooped out, turned up, or pinched in appearance that people may have had in the past. Nowadays, most people want a nose that looks like they were born with. The nose is one of the most prominent facial features associated with your ancestry. And no matter what your ancestry or race is, if your nasal bridge appears extremely smooth or overly contoured, that can be a dead giveaway you had a nose job, because the nasal bridge usually has minor irregularities or subtle asymmetries. And a lot of why this happens and why people end up looking unnatural with injectables or plastic surgery is because of mistake number 3, which is patients are dictating what treatments they have and how often they should have it. Aesthetic medicine is probably the only field to which you'll find strictly patients dictating their treatment. Imagine going to your provider and saying, yeah, I've got high blood pressure, so I want to start on hydrochlorothiazide and we'll start with 12.5 milligrams. This dictating happens a lot when it comes to filler, especially lip filler. People want to keep their lips looking sexy and plump. So oftentimes patients think their lip filler is gone. They come in to get more filler 6 months, 9 months later. We look at their photos and we realize that it's still there. Or I feel their lips and I can still feel a good amount of filler present in their lips, where I feel that if I inject more, it'll result in their lips looking unnatural. It's very easy to develop filler blindness because your brain always normalizes what it's used to seeing, or some people just have a facial dysmorphia. A lot of times people also feel that when they're doing lip filler and they're paying for a full syringe, they need to use the entire syringe to their lips. And this is what can get you in trouble. You have to remember, you're not paying for a product, you're paying for a service. And just recently, I had a patient I treated with under eye filler 2 years ago, and she thought it was gone. And when we looked at her photos to compare, it was pretty much still there. And the little bit that had gone, I didn't think it was worth it to do more, because when it comes to the under eyes, you can get in trouble with the complications of swelling. However, I'm not saying people can't dictate what they want to have done. You know your face and what will likely enhance your beauty. But if I think that we go too far, for instance, if I think adding more filler to someone's lips will result in them looking unnatural, I personally won't do it. You would have to find someone else. If you were going to a hair colorist, for example, and you have very dark hair and you want to go blonde, would you want someone who's going to tell you, sure, we can make your hair blonde, but if we do, it's likely going to result in damaging your hair, and you may not see the damage right away. It can take up to a year to see the damage to your hair, but it will likely get damaged and result in breakage. I would want that kind of colorist. Comment below if you would want someone who will let you know and was looking out for the health and integrity of your hair, especially if you you want long, healthy hair. And if I found that kind of hair colorist, I would stick to them, which brings us to mistake number 4. Another reason people end up looking unnatural is because they're going or flocking to different providers. It's wise to stay with one provider. I don't know about you, but do you switch up your hairdresser or do you go to the same person? Comment below and let me know. I go to the same person because they know my hair, my history, what colors we use. Sometimes people may go to different providers for convenience. Some people don't book their appointments until the last minute, so they call last minute, they can't get in, so they choose to resort to going to someone else because it's more convenient for them, or it's based on a better price. A lot of times people start out going to providers they thought were right for their first lip filler treatment, for instance, and then they get comfortable with the procedure and then they start going to other providers. But when I look at people who have gone overboard like this, I am truly amazed that a provider took part in making someone look like this, or maybe more than one provider resulted in this person looking this way. This is why it's important you don't make mistake number 5,
going with the wrong aesthetic provider,
and you find the right provider for you. Just remember the saying, someone will always do it.
You know, there's some surgeries that we see and I'm like, I can't believe a doctor okayed that, like the cat lady, Jocelyn.
The problem is there's, you know, in our specialty, there's a lot of emotional instability. And she represents that.
Yeah.
But the problem is somebody will do it. So once she's decided she's going to do it, somebody will do it.
When we see these kind of surgeries, like we see these outrageous things, is there, I mean, a responsibility on the doctor to say,
I think so. I think it's an ethical responsibility. They're looking to make a quick buck and they'll do it, you know, as long as the check clears.
But that's scary as a potential patient going in to know that anything I ask for I could probably get,
right,
even at my own detriment, because you're willing to do it if you're, you know, you don't have the integrity.
Going to a provider who provides natural looking results means that they may say no, even if they're not making money. They're not just going to do what you want. But don't forget to watch these videos next so you can learn what to avoid if you want to look more naturally beautiful.